A stroke occurs when the blood supply to a part of the brain is interrupted. This can happen due to a blockage in a blood vessel, known as an ischemic stroke, or a rupture in a blood vessel, called a hemorrhagic stroke. Brain cells deprived of oxygen and nutrients begin to die rapidly, making every minute critical in stroke management. Rapid and accurate diagnosis is paramount in determining the appropriate treatment and improving patient outcomes. Imaging exams play a crucial role in this process, allowing doctors to visualize the brain and its blood vessels. These exams help determine the type of stroke, location, and extent of damage, guiding treatment decisions and predicting potential long-term effects. The faster a stroke is diagnosed, the sooner treatment can begin, potentially minimizing brain damage and improving chances of recovery. Timely intervention is key to minimizing the devastating effects of stroke and improving a patient's quality of life. Computed tomography or CT scans are often the first imaging test performed when a stroke is suspected. CT scans use X-rays to create detailed images of the brain. These images can quickly reveal if a stroke is ischemic or hemorrhagic, a crucial distinction in determining treatment. In ischemic strokes, kinetic scans can show the area of the brain affected by the lack of blood flow. For hemorrhagic strokes, they pinpoint the location and size of the bleed. CT scans are widely available, fast and non-invasive, making them an invaluable tool in the initial assessment of stroke patients. Magnetic resonance imaging, or MRI, provides a more detailed look at the brain than CT scans. MRI uses a strong magnetic field and radio waves to create images of the brain's structure and function. While it takes longer to perform than a CT scan, MRI offers valuable information about the extent of brain damage. Different MRI sequences highlight different aspects of the brain. Diffusion-weighted imaging, or DWI, is particularly sensitive to early changes caused by stroke. It helps identify areas of ischemia within minutes of onset. Another sequence, perfusion-weighted imaging, or PWI, maps blood flow in the brain, showing areas receiving reduced blood supply. This information is crucial for planning treatment strategies. Section 4. Unraveling blood vessels, CT and Mester angiography. CT angiography, or CTA, and Mester angiography, or MRA, are specialized imaging techniques that visualize blood vessels in the brain. CTA uses iodine-based contrast material injected into a vein, while MRA uses a contrast agent that highlights blood vessels on MRI images. Both techniques produce detailed images of the arteries and veins in the brain. These angiograms help identify blockages, narrowing, or aneurysms in the blood vessels. This information is critical for determining the cause of a stroke and guiding treatment decisions. For example, if a blockage is detected, doctors can consider clot-busting medications or procedures to remove the clot. Section 5. Doppler Ultrasound. Listening to the brain's blood flow. Doppler ultrasound is a non-invasive imaging technique that uses sound waves to assess blood flow in the arteries and veins. A small probe placed on the skin emits sound waves that bounce off blood cells. The machine then analyzes the echoes to determine the speed and direction of blood flow. In the context of stroke, Doppler ultrasound can detect blockages or narrowing in the carotid arteries, the major blood vessels in the neck that supply blood to the brain. It can also assess blood flow within the brain itself. While not as detailed as other imaging techniques, Doppler ultrasound is a safe, painless, and portable option for evaluating blood flow in certain situations. Section 6. Combining the pieces. A comprehensive picture of stroke. Each imaging exam discussed provides unique information about the brain and its blood vessels. Doctors often use a combination of these tests to obtain a comprehensive understanding of a stroke. The choice of which tests to use depends on the patient's symptoms, medical history, and the suspected type and location of the stroke. For example, a CT scan might be the initial test to determine if a stroke is ischemic or hemorrhagic. Then, an MRI might be ordered to assess the extent of brain damage. If a blockage in a blood vessel is suspected, a CTA or MRA might be performed to visualize the blockage and guide treatment. Section 7. The future of stroke imaging, faster diagnosis, better outcomes. The field of stroke imaging is constantly evolving, with researchers and clinicians working to develop faster, more accurate, and less invasive techniques. New imaging technologies and analysis methods are being explored to improve stroke diagnosis and treatment planning. One area of focus is developing portable imaging devices that can be used in ambulances or remote areas. This would allow for faster diagnosis and treatment initiation, potentially improving outcomes for patients in underserved regions. Another area of research is artificial intelligence, or AI. AI algorithms are being developed to analyze brain scans and assist doctors in making faster and more accurate diagnoses. The ultimate goal of these advancements is to improve patient outcomes by enabling faster diagnosis, more targeted treatment, and ultimately, a reduction in the devastating consequences of stroke. As technology continues to advance, we can expect even more sophisticated imaging techniques that will further revolutionize stroke care.